was on the 29th of March that the government announced a mental health support package, anticipating ahead, I think, of the curve of most countries, the mental health impact that would be an inevitable consequence for many, many Australians. And to recall that package said, firstly, we must actually understand that the significance and the magnitude of the changes that we're being called upon to make as Australians to respond and protect our safety, our physical safety and the safety of our country, will have an impact on us. We are being required to live differently. We're being required to live in different circumstances, quite constrained circumstances. So we established a specific support line hosted by Beyond Blue, and I'll take you through in a moment just what we're seeing with some stats with respect to Beyond Blue. You may also remember that we said we actually have to take a preventative approach. We have to identify those particular groups in Australia who may be more vulnerable, and we need to try and make sure that we are putting in place supports for them. In that space, we did some support services for our older Australians, for our younger Australians who were particularly challenged with the breaks in their education, our Indigenous Australians, our emergency frontline workers. And we have seen, as we anticipated, that there has been an increase in services. We also, at that time, most importantly, as the Prime Minister has said, we made a shift which really was a 10-year shift done in 10 days, and I can't overestimate that, of moving our mental health services onto a telehealth platform in recognition that people could not get to them. So what has actually been happening? So I've chosen here just 3 snapshots of services that are being provided in the digital online space, but they're indicative of the broader range of services we have. Beyond Blue has seen a 40% increase in contacts being made to it over this time last year. And what we're seeing with respect to those calls is an increase in the distress levels, an increase in the anxiety levels, in the complexity of what people are feeling. We're also hearing, and this is an anecdotal, but I think we're hearing in something I will note later, that people are perhaps not feeling as safe as they once did. So I think that is a concern. We look at our Head to Health. Now, Head to Health was one of the initiatives that we boosted back at the end of March because we said it is incredibly important that we have a single source of truth where people can go to know the facts around this, what they need to do for their mental health and where can they go. You can see the enormous spike in visits to Head to Health. And our young people with Reach Out. And I'm really pleased to see and to be able to affirm what Reach Out has just done in this last week in launching a specific online support package for parents and young people as they transition back into school. We know that for our young people, they are incredibly concerned, not just about their education and the drop in education and the linkages there, not just about the fact they're not necessarily seeing and getting the supports that they did in a school environment. But our young people are concerned about the future. They understand the economic impacts of what we must go through for this, and they are understandably worried. So from a mental health perspective, it is incredibly important that we're actually there to support them. And again, we see that usage. But there are a couple of interesting things that are happening, and I want to just pause there and say what we're really looking at the moment is this current phase. And the current phase, and you'll hear me say this frequently, I do not use the word social distancing. I have an anathema to it. I use the word physical distancing with social connection, because it is about being physically distant, but how incredibly important it is to stay connected. And that has manifested itself in what we have heard over the last month. People are finding it challenging living in confined spaces. The most confined would be quarantine or required isolation, but for those of us staying at home, and that's the majority, the vast, vast majority of Australians, it is a pressure cooker. We're living with our loved ones. That doesn't mean it's easy. So they're the issues we need to deal with. Another issue that has really emerged has been a sense of loneliness for many Australians. For those Australians who live on their own, who actually cannot have that tangible reality of a hug from a loved one. We cannot underestimate the mental health impact that that is having on our Australians. And of course, there is the worry that is being addressed, but it is a worry about the job security, housing security, employment security, those issues. So what we would have hoped to have seen as a response to that is actually an increase in use of mental health services. The reality is that overall, there has actually been a decrease. Now, why is that happening? Why we think that is happening is that for those who would normally be using mental health services to support their mental health and wellbeing or their mental health challenges are not actually going out and doing those visits. Now, we partially addressed that with the pivot to telehealth, and it's incredibly important that we look at the increased use. If I can show you on this graph, the increased percentage use of psychologists using telehealth. It is now over the 50% mark. It is working. But what we do, and I do this as a call out to all Australians, we did come into this scenario, we did come into COVID-19 with mental health challenges, many of us. We did come in with mental illness. You do still need to contact your mental health services. You can do it now on through telehealth, you can do it through the digital services, but part of getting through this whole crisis is that we actually address our mental health and our wellbeing. So reach out. We will continue to do that. I think that's probably the most that I would want to say on that. The other thing we are noticing, just to support that last comment of a slight decrease, is generally our presentations to our emergency departments are down as well. So as I say, a call out to all Australians, your mental health is really important, your mental wellbeing is important. As I've said before, it's actually foundational. It's foundational to our creative resilience and being able to get through this in the best way we can. But also just some circumstantial things that we're hearing, which I think it's just important to put to our notice. If I can just go, thank you. I mentioned that in particular in talking to my colleague Georgie Harman at Beyond Blue, that they are hearing stories of people not feeling safe. And I think this is a reality that all Australians need to address. I've said before that it is incredibly difficult to go behind closed doors to see what is happening in confined spaces. But we can look at the increasing calls to 1800 Respect. We can look at the increased calls, not there, but which we have also recorded, to Men's Helpline. We know that this is happening. We know that people may be more challenged than normal to reach out for help. So I call on all Australians, keep your eyes alert for what may be needed. So what are we doing? In conversations this morning with the Prime Minister and with our Federal Health Minister, and reflecting on a very, very strong meeting that we had with Australian ministers responsible for mental health just at the end of last week, we are looking at significantly ramping up our ability to coordinate service delivery, to ensure that the accessibility that we've opened up with telehealth, the accessibility we've opened up with increased digital and online services, is able to be accessed by Australians in a way that passes across our jurisdictional and Commonwealth systems. We need to make that work better. We need to ensure that anybody who actually needs a service is reached. We're looking at how can we reach those Australians who are not currently coming to us for help. We know when we look at those we lose to suicide, that 50% of those we lose have not come in touch with our mental health services. We are looking to what we can do by way of outreach. So the Commonwealth is working in conjunction with the states and the territories on a plan, on a mental health response plan, which will look at what are we doing in the current scenario, what are the current specific issues, challenges and services we need when we're in this state of physical distancing and staying at home. Then we will look at what is the appropriate response as we ease those restrictions, and we must ease those restrictions. Now, as the Prime Minister has said, that is absolutely critical to us getting back to the life we all want to have. Will we be anxious during that time? Yes, that's inevitable. We can't stop the anxiety, but we can certainly support and address it. So the second phase that we will be looking at will be looking at the reality of that and how can we, from a mental health perspective, ensure that we're there to meet the needs of Australians. We will look at what are the particular issues, should there be surges or hotspots, and we will look at what is needed for longer-term recovery.